Hey guys, Ashley with Amare, and today we're going to talk about skin, scars, and all of the incisions and scabs and things like that for post-surgery. So what causes a scar, right? Because that's our biggest concern. We have this surgery, we look great, and now we want to figure out, okay, how do we make sure this doesn't scar? How do we make sure that this stays looking nice, or that there's no scar at all? Because that is possible. Some people you see and they have no scar. So how do we do that? Well, there are a bunch of different products you can use, and I'm not talking about scar tape. Scar tape is extremely expensive. If you have a big scar, it's like 35 bucks a box for Scar Away, and they're the tiny little strips. We don't use that stuff. Also, there are other things in there other than just silicone. We want to stay away from all of that stuff if you can. Sometimes that's the only thing you can get, and that's all we have, so we work with it. But we have other options here at Amare. So first of all, let's talk about the company. Recovery Care Products is owned by a very good friend of mine who I became friends with because I found her products. Very, very lovely lady. You can read her story in the links that we've attached and how she started her company, but basically she had very bad plastic surgery, like laser stuff done, and it's like scarred, and she didn't really have a place to find good products, which most of us don't. We don't know what to use after surgery. So she created this entire company called Recovery Care Products. Everything is post-op certified. Everything is gentle to be used immediately after surgery, some things even before surgery. So we're going to go through all the things that we use so far from her at Amare. And the first thing sounds ridiculous. Now, let's talk about scars, right? So how do we get a scar? Well, we know that there's a couple ways. A really, really deep incision, something that's really thick and wide, but most of the times it's something that's a lot of trauma to the skin that the skin has to heal. So let's think about it, right? We get a scrape, right? Let's say you scrape your knee on the sidewalk. It's super shallow. It's just the skin. You put a little, ointment on it like Neosporin or something, which again, I do not condone post-op, guys. That's not safe. I mean, some doctors will say bacitracin, some doctors will say Vaseline. If your doctor's saying that's okay, use whatever your doctor's saying, but there are better things out there that you can be using. So sometimes when you get a scrape, it's maybe like 2 or 3 days, then it heals and there's no scar or nothing like that. It's like a superficial thing. That scab is so thin, like super, super thin. When you're talking about like a deep cut and you get like a really thick scab, that's kind of when it scars. That's also why they say when you get like a deep cut like that, you might want to get stitches. It helps it heal a lot more smooth and not that much of a scar. So scars are equal to thick scabs. Thick scabs are equal to scars. That's how that happens. It's your body trying to make up tissue in there. Any abuse to the area will create a pretty nasty scar. So a tummy tuck that constantly keeps getting ripped open. Yes, I have seen tummy tucks get ripped open. They're going to scar pretty bad because you rip your stitches open, or you just kind of tear the edges of the stitches and not the actual thing itself, just from a bad garment doing too much, garments cutting into you. Boards, which are a no-no. We hate boards. There is never a call for boards ever. We don't use boards at Amare. They are torture devices, and I will explain that in another video. But basically, stopping the movement from around the thing itself and making sure that it doesn't pull. So obviously, you're breathing, your stomach's going to move. You're moving, the incisions on your back are going to move. Your face, if you had a brow lift or if you had a face lift, the incisions behind your ears, if you had eyelid lift, obviously you have to blink. Things like that are going to move. That's okay. It's about making sure that they are soft and supple and able to move and not dry and thick and cracked. Because when you crack a scab, as sometimes you guys know, when you like open your hand after that scrape, it kind of cracks a little bit and then it kind of leaks. And that leak is creating a thicker scab, which we don't want. So how do we stop that? By movement. Now I know this seems totally ridiculous, guys, but if you've ever had an apper bear or know someone who has, you're completely immobile. Like you can't sit up. So drinking water is number one. Staying hydrated, just like hydrating the scar and the scab, is the number one thing. So this is a water bottle with a hose. That's it. It seems like the world's most stupid invention, like the most simple thing. But guys, tracking your water is number one. Number two, making sure you can get to your water when you are in the recliner after a BBL or in bed. This makes a huge difference. Okay, moving on from that. The other thing that I recommend, which I use every night, is something to cool the skin. So around an incision, it tends to get like hot and red and burn a little bit. We don't use ice. Why don't we use ice? Because ice is extremely cold and ice will burn the skin, and the skin is already having trauma. So one thing that I love that Recovery Care Products did, and I use this personally, is a clay pack. So guys, this is clay. There's no like hardness in here. And just by having this out all day, it's already cold. Like it's cool to the touch. So I don't even put this, for me, because I don't need it cold, I just leave this out. And then I'll put this on at night after I jade roll and use my face stuff, I'll just put this on and it just cools the skin and calms everything down. And it's heavy, it's weighted, so it gives a little bit of like comfortable pressure. So I love clay packs. I would suggest clay packs. Recovery Care Products has clay packs. At the end of this video, we're going to be doing a giveaway, which includes all the things we talk about today and a little bit more. So I would suggest sticking to the end of the video, checking it out, and looking for our post on Monday. So, all right, how do we get the scabs to be hydrated, right? So we talked about Neosporin, we talked about bacitracin. Your doctor's going to try and give you ointment, but why does it matter, right? So if we heal something before it even gets to the scarring part, we don't have to get rid of the scar. And now anybody who's had scars know that it's kind of hard to do that. They got to heal. It takes time. It's a really long process. And if we are healing super fast with lymph drainage, getting the pressure off the scar to heal to begin with so that it heals thinner, we're going to want to make sure that the outside is also healing on top of that and it's protected from the world. So one thing is keloids. That's number one. If a scar is getting thick and swollen like a keloid, yes, keloids can be genetic. Yes, your body keloids, right? That just means that your body is hypervigilant with getting like all of the cells and stuff to the area and the fluid, lymph fluid, proteins, fats, white blood cells to the area to make sure that that tissue heals properly. So it kind of like hyper heals, which is what hypertrophic scars are, keloids. So it's a thick, really thick scar, and we can kind of stop that whole process and get it to not scar to begin with so you don't have as big of a keloid. Number one is making sure you stay hydrated. Now, hydrated, yes, water. Keeping your skin hydrated, yes, and ointment, which we'll get into. But what about when you shower? You're literally drying your body out. So if you're using Dial or HipaCleanse or, God forbid, something like Dove or Aveeno or St. Ives, like you just had surgery, you should be using something super, super clean. A gentle cleanser of sorts, not all of that stuff. Now, the doctors say HipaCleanse and, you know, all these other like super clean Dial, things like that, it's going to dry you out. Your incisions are going to get dry. Your skin all over your body is going to peel, which is not healthy because you're sitting in your garment and that flakiness is sitting in your garment, and even though you're washing it every day, it's still happening. So we use, from Recovery Care Products, all of our stuff that goes on the body, that goes directly on either open incisions or things that need to be healed, that's touching your skin, that's going to be absorbed, is Recovery Care Products, because I know the owner and it's super clean and everything in it is wonderful. So the cleanser that they have is a foaming cleanser. It has aloe in it, which helps with the skin repair, soothe, healing all around your incisions, keeping them hydrated while cleansing them. And it has arnica. We know our best friend arnica. We love arnica. Arnica helps with swelling, bruising, pain, and tissue repair. All the things we're doing right now. So this is going to help a lot. I use this after a rock climb. I love this stuff. If you see, I'm going to do one full pump in my hand. It's like a whole handful. It's a lot. It's a lot. So you want to use this stuff and you want to super, super lather it up all over, especially your incisions. So you want to get a full pump, like handful, and it's, again, foaming, so it's not like you're rubbing or friction against your incisions, which is why I love that it's foaming, because it's gentle enough to use over your incisions, to use over even open drains or holes, anything like that. It's super, super gentle, super safe. Most gentle cleansers are like a gel that you have to like rub and it creates friction, which is a nightmare. This stuff is great. The other thing that we use with that when you get out of the shower, again, keeping it protected. So our wound care from our healing ointment from Recovery Care Products is going to change in the next couple months. We still have this in stock. You guys can, if you're coming into the office, ask for it. I give it to you. We talk about it in your first session anyway. But this stuff on the back, purpose is skin protectant. That's what it says. It's 41% petroleum. The rest of the stuff in here. Now, all of these products, I will have the links to the fact sheet so you guys can see what's in them and see what Recovery Care Products recommends. But this stuff has, I think, vitamin A, vitamin E, and vitamin B. Don't quote me on that. Could be wrong, but I know it's got tons of vitamins in it. So this is kind of like liquid Band-Aid meets Neosporin. This literally goes on like liquid Band-Aid and like coats the incision. We use this on open wounds, your open drains, your open incisions. This will literally close your wound in 2 to 5 days. I've seen it do it in 2 days, depending on how deep and how open your wound is. It will dissolve your stitches. If you have really thick scabs over your dissolvable stitches, this will help kind of melt that so that your scabs are not thick, so you don't scar to begin with. We love this stuff. A little goes a long way. The well on this is extremely, extremely tiny. I don't know if you guys can see that. It's super, super tiny. You literally only need to, see if I can do this without squirting it everywhere. You literally only need to fill the well, and that's it. One swipe of that will cover an entire tummy tuck incision. So it's super important to make sure you have an ointment that is clean. This is literally just petroleum and vitamins. That's it. There's nothing else in this. You're putting it directly on your incision. Something like Neosporin and Bacitracin, I would stay away from, especially belly buttons, guys. You scar around your belly button. When you get the lollipop for breast explants, implants, reconstructions, this stuff is great. So make sure you have a good ointment that's going to work for you and not create goop or thickness. We want to stay away from thickness. If any ointment that you're using creates thickness or dryness, stop using it because it's not working. That stuff is liquid Band-Aid and it hydrates. It makes your scabs very soft. It keeps them from cracking and peeling, and it keeps them from getting thick, and it helps dissolve the stitches. How dissolvable stitches work? When the stitch is put in, it's put in on the inside and the outside. So you're seeing the outside of the stitch. The rest of it is in here on the inside of the skin. This is the scab right here. When the scab, it heals on the inside, the stitches is dissolved on the inside. Then you got the little strings. When the strings and the scab, when the scab is ready to peel off of the body and fall, it takes the rest of the stitches on the external side with it. That's how that works. The quicker we can heal you internally inside that incision with this stuff, the quicker you get rid of those little incisions on the outside that can potentially hurt if they are dry and they're stabbing you in the back. So there's that. Now, what happens if afterwards we still have scars? Because we didn't get to use any of that stuff. Their silicone is amazing. It is literally pure silicone. Guys, this is the same stuff that is in your silicone scar tape. This is just 100% silicone. There's no adhesive or anything like that that can irritate you. This is also a very tiny, tiny nozzle. A little goes a long way. This stuff goes on like silk. As you spread it on the body, as it heats up, it spreads. So I suggest, same thing like with the wound care ointment, just a tiny little bead. One full pump of this will cover your entire incision and then some. Your tummy tuck incision, hip to hip. So a very, very, very little bit of this goes a long way. Now, recovery care products on their sheets have different suggested uses. For this, I say twice a day, morning and night. For the wound care, 3 times a day, you want to keep that hydrated, keep your incisions clean, keep them protected, this stuff. For showering, if you can, once in the morning, once at night, twice a day, use this stuff to clean your incisions. You're sleeping overnight, you're sweating in your garment, it's sitting, you want everything to be clean and clear. Now, going out during the day. A lot of you guys, I don't know why, love to get surgery done in May. You want to be ready for Miami in June and July. I understand that. But you're going to have a scar, and you're going to be in your bikini, and even through your clothes, guys. The rays of the sun get through your clothes. So you don't want to use sunscreen, regular sunscreen, on a scar like that. You want something that's actual minerals. So this is literally like a block. This whole thing is a block of sunscreen. Like, it's literally like chalk, the whole thing. There's no liquid in this, nothing like that. It's literally a mineral stick. So also, little goes a long way with this. I mix this in my face oil in the morning, and I will put it everywhere. And yes, it will make you very, very pasty. So a little bit of this, if I can get it on here, is because it's super, super thick. And that's just a little bit. And guys, I'm dark. And rubbing that bad boy in still makes you a little pasty there. So definitely if you wanted to mix it with, you know, cocoa butter or something like that to kind of get it on your scar to hydrate, that would be wonderful. I mix this with the wound care and have people put it on their wounds when you're going out, even if you think you're covered. But if there's sun, put it on and add it together so that you make sure this acts as a physical barrier. Again, the info sheets will have all this on it, but this is literally a physical barrier between the sun and your incision. A lot of sunscreens soak into your skin and reflect the rays of the sun. This literally stops them right at the surface before they get to your scar. Guys, don't play games with your scar. That is not okay. So how do we prevent scars? We don't let them happen in the first place. Take care of your incisions. Use proper products. There is an affiliate code we will add in the link. Let me see if I have it here. I don't have it here, but we will add it in the little description box for you guys and like the show notes almost down there, so you guys can use that link on the recovery care product website all over, and you will get, I think, 15% off. I'll also link the product pages and the bio for recovery care products about how they started, and that's a little bit on skin and scars. So again, key to not having scars is don't create them. You can use scar stuff, but guys, please be careful. If you use it too soon, it will make your scar darker. Yes, that happens. We'll talk about that in another video, about all the things that can go wrong that your doctor tells you to do that really you shouldn't be doing. So just please be careful. You can always schedule an online consult with me. The prices are in our highlights pricing. If you have questions about these things, if you want to talk more about them, if you want a specialized treatment plan, if you got stuff that's not healing right, please feel free to contact us, set up an appointment, and I will talk to you guys so soon. Stay tuned for the giveaway that's coming up on Monday. Bye, guys.